Hello, welcome to GP Notebook TV. My name's Dr. David Miller-Jones and I'm going to talk about e-cigarette use or vaping, and recently the MHRA report of lung problems associated with this pastime. Currently, it is estimated that 3.6 million people use e-cigarettes in the UK. Nicotine-containing products are now regulated since 2016. Authorities in the USA are investigating a multi-state outbreak of e-cigarette and vaping-associated lung injury known as EVALI. Currently, the incidence of this is much lower in the UK than in the USA. The difference in magnitude may be due to differences in regulations, the differences in nicotine strengths available in the UK, or the chemical substances or devices used, and also it appears that in the UK we have a higher level of younger population who are vaping. However, it may also be because we have a lower index of suspicion among healthcare professionals within the UK environment. If we would suspect lung problems associated with vaping, we should, as healthcare professionals, fill out yellow cards. Looking at the USKA cases, since March 2019, there have been 2,600 cases of EVALI, 60 associated deaths. 95% of patients have required hospitalisation and a high proportion ITU care. Most cases present with non-specific respiratory symptoms such as cough, dyspnea and chest pain, but also presenting with other associated symptoms such as gastrointestinal problems, fever, chills and weight loss. When we look at somebody with respiratory problems, we should consider whether this is a probable case of EVALI or a possible case. Probable cases are cases where e-cigarette or vaping has been undertaken within a 30-day period prior to symptom onset. Radiological investigations, whether it be X-ray or CT, have shown changes of opacity, pulmonary infiltrate or ground glass changes. Patients should ideally have exclusion of respiratory problems and other underlying pathologies such as cardiac, autoimmune or malignancy. Possible cases are patients with symptoms, X-ray findings, but they already have an underlying infection, but the infection is not believed to be the cause of their significant respiratory compromise. If reporting EVALI, then contact the e-cigarette reporting tool for electronic yellow card scheme. If reporting a case, specify whether it is a probable or a possible case. Provide the full details of the vaping product, the vaping history, and other potentially relevant clinical details, which would include combustible cigarette smoking history and investigation results as available. How should this change our clinical practice in primary care? We should be more vigilant that vaping and e-cigarettes may cause respiratory problems. When documenting cigarette smoking, we should also document e-cigarette history. Putting together a vaping record. This should include the name and brand of the product type if known, duration and frequency of vaping, the substances that are vaped, whether it be nicotine or recreational substances, and strengths of substances used. Thank you for listening.